Hello everyone. This 50 radiology quizzes in 15 minutes is through the online quizzes which had been conducted by the quiz masters before Aocr 2025 Chennai, which had been held on 23rd to 26th of Jan. You can see glimpse of the organizers of Aocr in the end of this session. But here you can see the quiz masters conducting the quiz and all the participants who underwent and participating in the online quiz. Now we can go to the quiz right now. Each quiz will go for just 10 seconds and then answer will be given. It will be there for another 10 seconds. I'll request you to be prepared with the paper and pen if you want to know how you are, especially if you're a student. We'll go to the quiz right now. That's the first question. That's the most common cause of painless diminution of vision of only one eye after 45 to 50 years is NION, non-arterial ischemic optic neuropathy. If you are unaware of this entity, please read about it. Here you can see at least 3 detectors in the down curve. So it is multi-detector CT. Yeah, this X-ray foot is very typical of, especially with knee findings, the MRI, and the answer is the good, and the crystals in the good are needle shaped and are negatively birefringent. Here you can see typical MCU showing pear-shaped diverticulated bladder with severe bilateral VUR, which is very classical. There is no nephrogram if you thought about IVU. That situs inversus also having reverse double bubble appearance with 11 ribs. Very classical about Down syndrome. That's anterior ethmoid notch with its landmark for anterior ethmoid arteries, which can be injured during FES. This is very typical of interstitial pregnancy, a rare type of ectopic pregnancy detected well on 3D ultrasound and on MRI. The MRI image shows atrophy of abductor digiti minimi due to the Baxter's nerve entrapment affecting the inferior calcaneal nerve. Here with the clinical history, the arterial enhancement and complete washout in the delayed image is typical of Lirart's 5, which does not need biopsy for confirmation. It's very classical. It's typical prune belly syndrome with the triad of absence of abdominal wall musculature, renal dysplasia, and undescended testis. PUV is not in the triad. Wrong one is the C, which has pear-shaped bladder, but apple has been given. Rest of them are very correct. Given all are typical of Arnold Chiari type 2 malformation, and so the answer D is false. It's a case of moya disease, which is idiopathic, non-inflammatory and progressive disease, and so A is wrong. It's a typical case of achalasia cardia with typical bird's beak sign. Peroral endoscopic myotomy is the minimally invasive procedure performed by medical gastroenterologists in only few centers of India. It's a typical case of achondroplasia, which is autosomal dominant, and that's the answer. X-ray pelvis shows avulsion fracture of the right anterior inferior iliac spine where rectus femoris is attached. Please read about the attachments of other muscles and tendons, which are also very informative. Barium suspension is diluted with the water by volume, which is 95% water by volume in microbar suspension and 200% water by volume in microbar high density. So that's the answer. Here it looks easy, but it's not, because the diagnosis is simple. It's tuberous sclerosis. All are correct except C, where they have been reversed. The tuberous sclerosis complex 1 gene is in the chromosome 9 and tuberous sclerosis complex 21 gene is in the chromosome 16. That's the answer. In normal lateral ankle view, the Bowler angle should be between 25 to 40. If it is less than 20, it means depressed calcaneal fracture. Please read about the Gisson angle if you are interested. Here you can see air pockets in the non-dependent wall of the stomach, which is typical of emphysematous gastritis, where the patients might not be very sick. Even with portal venous gas, the conservative management is the rule unless otherwise proved. It's not an easy question. Dermatomyositis is easy to diagnose, the answer being C. They said long head of biceps tendon looks abnormal here. In the second trimester, if a lady has to undergo CT angio for pulmonary embolism, it's nice to swallow diluted barium sulfate solution as an internal radiation shielding. Large echogenic content herniated anterior to the bowel with blood vessels is typical of omphalocele and nothing else. This is TIPS procedure, and portal vein thrombosis is one of the indicator of TIPS, and rest are relatively or completely contraindicated. So B is not a contraindication. 95% multi-Hans is excreted through the kidneys and less than 5% is excreted by the hepatobiliary system. So B is the answer, where it has been given as 25%, which should be less than 5%. MR guided high intensity focused ultrasound of brain is nowadays treated for all the above except ophthalmoplegic migraine. You can see the blood pool here. It's the venous structure draining into the SVC. So it's azygous vein aneurysm. It's Ovira syndrome, which is obstructed hemivagina with ipsilateral renal anomaly. Please read about MRKH and Swyer-James syndrome, which are also important. But Zinner syndrome is a male counterpart of Ovira syndrome. Read about that. This is ossifying fibroma, but given others can mimic so in MR, but CT is classical for ossifying fibroma. There is duodenal diverticulum obstructing the CBD, which is called as Lemel syndrome. You can also read about the others, which are also very, very important. Geniculate artery embolization is recently treated for mild to moderate osteoarthritis, which is clinically improving but not evident on MRI. So statement in C is wrong. Rest of the statements are correct. With the given images whether rheumatoid arthritis or scleroderma, but presence of subpleural honeycombing favors rheumatoid. Here median nerve is involved with compression syndrome in a case of fibrolipomatous hematoma, which can be associated with Klippel-Trenaunay syndrome and macrodystrophy. Ulnar nerve is not commonly involved. If you are in research or in statistics, more than 80% is acceptable, and that's the answer here. Here it's wandering spleen, and you can see the splenic vessel going to its hilum and with no ischemic changes in the spleen. That's the balloon catheter with the contrast distending it. That's transcervical chorionic villus sampling with the blind 16 gauge needle, which is called as olive tip, going through the placenta. Photon counting CT scanner gives uniform weighting of the photons, and so A is wrong. Rest of them are correctly mentioned. In a 70-year-old female with these pictures are classical for BIRATS 4C category, but option is not given, so C is the correct answer with mucinous carcinoma BIRATS 5. Here C is the correct answer with acute right sublingual sialadenitis with prominent sublingual artery flow void in right side of floor of mouth, which will not be evident normally. Here B is the right answer due to the hyperintense lesion in the fat sat T2 weighted image with poor uptake on CT PET, which is characteristic of chondrosarcoma. Mayo Clinic diagnostic criteria for autoimmune pancreatitis is correctly given in all except B. Here sausage shaped pancreas is correct but shows no early enhancement is not correct. Here it's typical of umbilical vein aneurysm which should be more than 8 millimeter and is doubled than the normal umbilical vein. Osteonecrosis of scaphoid is called as Priester disease. You can also kindly read everything about the rest of the osteonecrosis. At least 10 are there which need to be known by everyone. This is typical of dendritic type of gynecomastia bilaterally more on the left. You can see the plateau wave after contrast, which is typical of it. Cases from the cookie jar in the RSNA radiographics are extraordinary teaching files being studied by many thousands of radiology students worldwide. Hence, D is the right answer. MR and DSA are favoring focal nodular hyperplasia, and the SPECT is very classical for it as this uptake would not occur this way in the given other options. Given is typical of iliotibial branches commonly seen in runners, especially untrained runners injuring the iliotibial band. I am Dr. J. Jitendrian, did my MD in Sion Hospital, Mumbai. At that time, Dr. Gurdeep Singh, who is now the president of IRA, had been my colleague and close friend during my residency. It was very nice to see and talk to him during this proud moment. Long live IRA and radiology. To all my visitors and listeners, thanks a lot. Take care. Bye bye.